Hi, I'm Candace with Slusher Consulting, and I'm here today to talk about another tough conversation. Seems to be the theme this year. I want to talk about diversity and inclusion in home care and when ethnicity can become a topic of conversation with your clients. We don't want that, but it does happen. And in order to protect your agency and your caregiving staff, and sometimes even your clients, sometimes that needs to come up, okay? So, bottom line is if a client is discriminating against you or your staff for reasons of ethnicity or culture, sexual orientation, appearance, religion or political orientation, or just about anything else that can get ugly these days, you and your staff do not have to service these clients. Okay? There may be someone else who's another agency that's more tolerant of that. But there's nothing wrong with you just making it clear that we do not work with prejudices and this is not going to work for us, and just walk away. And that's okay. You have the right to do that. And again, more so, you have the responsibility to protect your staff and not send them into a situation where they would be at minimal uncomfortable. Okay. But it is 2023. And so such prejudices just really aren't acceptable anymore, at least not in the home care realm. And so in your hiring practices, you can't discriminate. So it's certainly reasonable that your clients would need to adhere to those same practices. Now, there's exceptions to every rule. And the only time I would really cater to someone with prejudices of some sort is if they have dementia. And it's okay to just dig in and ask some of those questions. Like maybe you have a phrase just saying, just want you to know, we're going to send the caregiver with the best skill, availability, and personality fit for your loved one, red, yellow, black, or white. Okay. And if they flinch at that, then dig a little deeper. You want to talk about it because they might just say, my father was always so kind growing up, but since his dementia, we as a family have noticed he makes comments to or about staff in the hospital, about their color, or about something else. And they might be embarrassed about it. But if dementia is involved, then the client's inability to inhibit their own language can be an issue. And then you may want to make an exception. That said, if the client has always been a racist old jerk, then you don't have to accept that. So still weigh that out and make sure that you can staff it and even restaff it with somebody who can understand and tolerate that. Or, if there's only one type of caregiver that this client is not going to insult and you don't have that caregiver, then again, that's your opportunity to say, maybe there's somebody else that can help you and to walk away. Again, these are uncomfortable conversations, but you do have to have them with the family. If the person has dementia, you're going to ask about caregiver preferences because maybe they've had experience before and they say, well, I don't want anybody who talks too much, or I don't want somebody who's too quiet. I need social engagement, or, whatever. But if there's red flags, if there's any kind of little prejudices that come up again about ethnicity, sexual orientation, or religious or political affiliations, or appearance, right? Like, I ain't no tiny girl, and I have heard more than once somebody make a comment about my weight as if that has anything to do with, my capabilities. And so it doesn't. Again, it's 2023, and caregiving starts with the heart. So you are going to hire the person with the best skills and availability and personality fit for the client. But if they want something else and you don't have it, it's okay to just walk away. Because the last thing you want is to put a caregiver in a situation where they're vulnerable, where they're being attacked verbally or worse, okay? Insulted, assaulted, whatever. You don't need the backlash, but you don't want to do that to your caregivers. That's just not right. Now, again, when there's dementia, that's when you're going to have that conversation. And there's other ways to be inappropriate, right? Like a gentleman with dementia might be sexually inappropriate, and you'd have to prepare your caregivers for that kind of thing too. Behaviors that come along with dementia are, acceptable to an extent, but behaviors that put your caregivers at risk in any way are not acceptable. And those things need to be addressed on a deeper level. So don't ignore red flags. In my experience, when you do ignore a red flag or the family says, well, there was that one time, but it's only happened once. It's an isolated incident, and you don't ask any further questions, sure enough, in a few months, you're going to realize that every time you send an ethnic caregiver to that client, there's something wrong, something happens, or they complain about something stupid, or, you'll see the pattern. It's going to come back to bite you later. So just go ahead and dig in and ask about those red flags. Use your gut and make sure that you're being fair to everybody. Okay. Diversity and inclusion is something that everyone is talking about now. Um, it's the dawning of the age of Aquarius, and everybody loves everybody, and we're here to take care of everyone. So I hope that this is helpful for you. I hope that this enables you to have that tough conversation if you have to, but I also hope you never have to. All right. Take care.